This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to explain shin splints. So chances are, if you're watching this video, you may have shin splints yourself. Maybe you just increased your activity, maybe you've started running more and it's really bothering you. So today I'm going to explain what are shin splints and what do you do to get rid of them. So first, what are shin splints? So a lot of bones in your body are surrounded by this layer called a periosteum. And this is something that when you're in adolescence and you're growing, or a child, it's contributing to bone growth. And as an adult, it adds some stability to your bone and also provides blood flow and healing properties. So your tibia bone, which is your main shin bone, the bone that gets irritated in shin splints, is surrounded by this periosteum. And what happens is that if you're doing new activities, your calf muscles start pulling on this periosteum, essentially where the muscle is attached to, and it causes inflammation. And that causes pain. So what shin splints are your calf muscles pulling on this periosteum, which surrounds the bone. It gets inflamed and causes pain. So that's what it is. What else could it be if you have pain in that area? So you want to differentiate it from two other things. One is a stress fracture, which means that your bone actually has a crack in it and is broken. And the treatment for that is entirely different than for shin splints. So the good news is that it's pretty easy to differentiate. Shin splints usually gets better once you start running and doing activities, while stress fracture will feel worse. So if it gets better when you run, you probably don't have a stress fracture. You probably have shin splints. Another thing that can cause pain in similar area is something called exertional compartment syndrome, which means that your muscles get really, really tight and don't get the blood flow they need when you exert yourself. Again, that's something that gets worse with running or activities, not better. So that's in a nutshell what shin splints are. So what do you do about it? Well, unfortunately, the best treatment for shin splints is to stop doing the activity that's causing you issues. So if you're running a lot, you may need to take some time off of running, which no runner ever wants to do. Things you also can do are check your shoes. If you're running a lot, make sure you change your shoes every 500 miles and the fit is appropriate for your foot. You can also try anti-inflammatories, icing helps. Physical therapy isn't a bad idea to strengthen the muscles and loosen things up as well. But usually the best treatment is just to avoid activity for a while. If you keep running with shin splints, it's likely just going to hurt. It usually doesn't cause any long-term damage. I mean, is there a chance you could get a stress fracture? Yes, but it's usually pretty low. And shin splints is not something that ever really needs surgery. I mean, it's done in super rare cases. I don't think it's done regularly where they'll actually remove some of the periosteum. But by and large, if you have shin splints, it just takes some rest. It'll go away and then usually doesn't come back. So I hope I was able to explain shin splints to you. If you have any questions that I didn't answer, feel free to leave a comment below and I'll do my best to respond. We put out new videos every Friday. So if you like our content, please like and subscribe, and thanks for watching my video.